The normal dose is 3 tablespoons.
Oh, wow.
That's 45 grams of just toxin. Visceral fat is the number one inflammatory organs, I would say. It turns out it's an actual endocrine organ, secretes all sorts of myokines, anti-inflammatory substances. I tell them to lift weights. That's like my number one. I do a one-on-one to the gym first. I teach them the functional lifts.
What if Alzheimer's disease turns out to be a problem with muscle and the muscle-brain axis more than anything else? My next guest is actually Dr. Sixpack, who could actually provide us with some insight on Alzheimer's and brain disorders. And this is a first. This is the first episode I'm ever recording live in studio, and this is actually his first episode bilingual. Yes. So a lot of firsts here today. If you like this format, please let me know if you like the live interview format. And hi, if you're new to my channel, my name is Dr. Josh, and you're watching Alzheimer's Breakthrough with Dr. Josh Helman, the focus on hope for prevention and reversal of Alzheimer's disease. And Dr. Oak, it was a pleasure to meet you last month.
Yep.
Right after
Likewise.
I gave a lecture on Alzheimer's disease at the Buck Institute in California, and and we only had a brief amount of time to talk afterwards.
Yep.
So I love that we're now capturing our conversation here in Florida in person. Your background is remarkable. You are. Well, let's just start with it. Your name is Oak. Was that
Sure.
was that given to you as a child or a more recent?
Sure. So hello everybody. So my name is Dr. Oak. That's my nickname. My real name is Suparak Vijaranayan. That's my Thai name. I'm a medical doctor from Thailand. My main focus is in prevention, longevity, and I am a diplomat of the International Board of Lifestyle Medicine and the American of Anti-Aging Medicine as well. So to answer your first question, Dr. Josh, and before that, it's really my honor to be here with you in person, and attending your lecture was very fascinating and very profound on the new innovations of Alzheimer's. So my nickname Oak was given to me at birth, right? So every Thai person born at birth were given 2 names. An official name, which is Suparak, that's my official name,
right.
And last name is Vijaranayan, but you can just call me Dr. Oak,
okay,
or Oak in short, doesn't matter. So that's my nickname, right? Oak. My brother name is Ice, so I have a dentist brother whose name is Ice.
Okay.
So yeah, so that's my nickname, like Oak like Arnold, or Oak like tree, but I like Oak as Arnold. One of my heroes.
That's awesome. But you're at least on social media, and it's impressive. You have millions of followers on social media, and like myself, you're educating the public on reversing aging and improving the brain. But your nickname there is also Dr. Sixpack.
Yeah.
And I understand that you also historically have been a bodybuilder. Is that how you got the nickname Sixpack?
Sure. So yeah, I used to grow up in Wisconsin and North Dakota as well.
Right.
So I was like 12. I was very small as a kid, very skinny. And as you know, Americans are much bigger. So I was kind of bullied in gym class, just like everyone else,
right,
who was skinnier. So I got really into lifting and bodybuilding. Amateur, I wouldn't call it. I'm not a professional bodybuilder by any means, but
okay.
Got to protect myself somehow, right? I mean, I'm no longer hold by that anymore, but
okay.
So I studied bodybuilding, nutrition, supplements, biochemistry, and really fell in love with just how the body works. I was really puzzled by the mechanism of how muscle growth works, protein, weightlifting, just anything as a kid, you want to look good, you want to impress girls, but those are superficial stuff, of course.
Sure.
Now, my nickname, Dr. Sixpack, I choose that name, and people call me that because, one, doctors in Thailand, I don't know about here, but doctors in Thailand I would say half are don't have six packs, but you don't need a six pack to be in like good shape. I use that. I don't mean to bash any doctors. Just to point it out, right? But it is something that comes with discipline,
Right.
and knowledge, and taking that knowledge, putting it into discipline. So it is something to stand out by, because you can count on probably two hands the number of doctors who actually, stay fit and practice what we preach. I'm sure all doctors, we have good intentions.
Of
we
course.
have all the knowledge in the world, but applying that and living that and really being passionate about it, it's what, that's where my nickname comes from. Yeah.
That's
pretty much.
That's awesome.
Yeah.
And you shared with me that you basically have very little visceral fat. And because of course, if you have visceral, the dangerous fat that is around your organs, unfortunately, you're probably not going to be able to see much of your six pack.
Yeah. Well, there are three types of fat, right? The muscular fat, visceral fat, and subcutaneous fat. So I just got my DEXA scan done recently. We were just talking about that.
Right.
I was very surprised that my subcutaneous fat is higher than what I thought, because I have visible abs. So I thought I would have like sub 15% body fat.
Right.
As a bodybuilder, we're very calibrated on the calipers, on the in-body and whatnot.
Sure.
But on the DEXA scan, it showed a completely different result. My subcutaneous fat was around 17%, but with visible abs, but not super shredded or anything, not stage ready. But I was like, whoa, that's strange. But my visceral fat showed 0, like 0.0, not even a little, but 0.
That's amazing because it's the visceral fat, which is the inflammatory fat that causes inflammation throughout the body, including the brain.
Yep.
And I think for our listeners, that's one of the most important concepts, is that we want to turn down inflammation throughout your body. And one way to do that is to work on increasing your muscle size and decreasing the amount of visceral fat.
Oh yeah, I think that's number one key, one of the few key of longevities for sure, is minimize visceral fat, maximize skeletal muscle naturally, of course. I don't condone you go over, exogenous substance unless, you're with a physician who's trained in that.
Sure.
Definitely, Dr. Josh, definitely. Visceral fat is the number one inflammatory organs, I would say, right? Because fat is an organ.
True.
Yeah.
True. And I mean, years ago, decades ago, when I was in medical school, we thought that fat was just this inert thing that just lived in the body and didn't do anything. But we now know it's highly metabolically active. And speaking about metabolic activity, it turns out that the brain itself is highly metabolically active. 20% often of the blood supply will go to the brain, even though the brain is only, say, 2% of body weight. So but it's amazing. But in terms of metabolically active, it's the fat, but it's also muscle, right?
Yeah. The muscle, I thought it was just some vanity organ.
Right.
But it turns out it's an actual endocrine organ, secretes all sorts of, myokines, anti-inflammatory substances.
Right.
So it shifted my focus, Dr. Josh, from just aesthetics, strength, now to the key muscle of longevity. And that's one of my main message to my audience, which we probably share the same population, 40 plus female, 50s and 60s. I tell them to lift weights. That's like my number one, okay, before you do supplements, before you do any exogenous peptides or any fancy stuff, before you do stem cells, before you go crazy on that. I mean, I'm not against any of that. I'm all for it, but do the thing on the, the low hanging fruit first, which is just do squats after your meal. Start with that. Or maybe if you have knee osteoarthritis, just do leg extensions and hold it. That lowers, postprandial glucose, after meal glucose by a lot. So that's one of my main message and why it connects with Dr. Sixpack, because I want people to go lift. So my main purpose of creating my online platform now with over 3 million followers all over Thailand and the world, I just want people to lift. I just want girls to lift. Honestly, I just want girls to lift because, they look good. But then past the point of looking good, fall prevention, osteoporosis risk reduction, Alzheimer's reduction, cancer risk reduction,
Right.
every disease reduction, I would say, right? I mean, what are your thoughts on that?
Overall health, I agree with you 100%. And what I was impressed about to hear is you actually, with patients, you'll actually work out with them in the gym.
I do.
I mean, right. You practice what you preach.
I do.
That's awesome.
Yeah. So I do a one-on-one to the gym first. I teach them the functional lifts, like squat, glute bridges, lunges, overhead press, farmer walks, dead hangs, all sorts of lifts that is safe on the joints and movements that we do every day, but we don't know that it's actually an exercise that you can train for, become stronger at as you grow older.
Right.
In Thailand, Dr. Josh, we have a belief that, it's normal because we're getting old.
Right.
It's normal to take 10 meds because we're old.
Right.
But is it?
Right. So to be clear, I'm not opposed to people taking medications.
No, I'm not either.
But in general, if I find someone on 10 different medications, often there are side effects between all these different medications.
Yeah, polypharmacy.
Yeah.
Yeah. So like you said, I'm not against meds at all. And I'm not against any doctors prescribing meds. I'm prescribing meds myself. If I see LDL over 190 and they come with a big belly, of course I'm going to give them statins, but it doesn't end there. What about, do they know how to squat properly? Do they know how to, carry stuff over their heads? How are their knees? How are their muscle?
Right.
Because most Thais, we don't lift. And we think lifting is for young kids. We think lifting is for younger generation. When I tell them no, the older you get, the more you have to lift.
Right.
But that doesn't mean more weight. Doesn't mean explosive. I mean, it does mean explosiveness, but to a minimal degree. You start baby step. You got to baby step yourself. At least you need to be able to stand up without, using your hands.
Right.
You got to be able to lift stuff over your head. What about when you're going to travel across the world? How are you going to lift, your bags to the compartment? So yeah, my other focus is in teaching people how to properly exercise, mainly to seniors.
Sure.
Right. But all populations benefit from lifting,
right.
As you probably know.
Of course. So, but for seniors, what types of exercise do you think are important and you teach to your patients and audience?
Yeah. So my one-on-one, Dr. Josh, I encourage like functional movements. Like I said, functional movements, all the squats, lunges, deadlifts, but body weight first. I start with body weight.
Okay.
And I encourage everyone to, when you lift, have a mirror, or record yourself. Because otherwise, you have no idea how you look.
So a good form, unless you happen to be there with them, then you can say, like, watch out your knee or something like that.
Yeah, so my first session, I would be with them for like 2 to 3 hours in the gym, but not intense lifting. It's more of a posture corrective session. Okay, so let me look at how you squat. Are your back straight? Are you able to go down deep enough? Or do you have knee pain? Where are you at? And again, everyone is completely different, right? Someone with osteoarthritis knees, they can't do deep squats. So then we got to baby step them from, box squats. I also like the back extension. If you know the back extension, it's very underrated machine, but it's so good for your spinal muscles, for your low back, for your glutes, for your hamstrings.
But you have to know what you're doing because you can easily damage your back if you use too much weight too quickly.
Very important. And thank you, Dr. Josh. Like I said, I start with body weight.
Okay.
But please, everybody, body weight, right? Body weight deadlifts, body weight overhead press to see if your joints can fully extend. What is your range of motion? What is your limitations? Do you know how to do abdominal bracing? Because no one knows how to do that, right? Even when I started doing lifting, I didn't know what abdominal bracing is, but that is like a movement that everyone needs to learn before they pick up, heavier things. Without herniating your back, you gotta do abdominal bracing. So I teach, seems like a basic movements, but it's very complex. Like deadlifts actually a very complex movement, picking up stuff from the floor without herniating your disc. So I teach a lot of that, mainly basic functional body weight movements in the beginning.
Sure.
But as they progress, Dr. Josh, I tell them to record and send it to me.
Okay.
This is a one-on-one.
Sure.
I can't do this for everyone, but on the one-on-one clients, they send me videos of their workouts, but I tell them to get a proper trainer as well. I can't be with them every single session. But on the first session, what I do is I record everything. I record when I teach them their incorrect form versus their correct form. So I do very detailed, like super detailed. And I think key, Dr. Josh, is recording because you won't remember. You won't remember anything. It's, I teach them 10 movements in one go. How are you going to remember that? And it took me like years to properly deadlift without hurting my back. Just to give a background, so I did a lot of powerlifting as well.
Okay.
I think I did my best deadlift was like 405 pounds.
Wow.
And I was 150 pounds.
That's amazing.
Yeah, I don't do that heavy anymore. I mean, I do like 315, 350 pounds on a good day.
Okay.
But I hurt myself from, pushing too hard. I actually have a herniated disc as well.
Sorry.
I was completely fine. But now I got back into lifting, but I rehab myself. So that's my other focus is to rehabilitate old injuries. I've been through so many injuries. I have wrist injuries, I have shoulder injuries, I have back injuries. But my message to you is don't let that be a hindrance. Don't let that be a imprisonment.
Sure.
That be like, oh, I can't do what I love anymore. My passion was in weightlifting, exercise. But once you have a herniated disc, you would know even just sitting down. It's like an electric shock down to into your feet. But I overcame that. And that's why I do what you do as well. I do a lot of exercise live sessions. I teach them how to properly lift without getting injured. I think that's so key. It's super key. The thing about lifting and muscle building, it's not about how heavy you can do it.
Right.
It's about how long you can do it. I think that's most important.
And if you're trying to build muscle, it's the amount of time under tension.
Yes, TUT.
Which ends up with the building. Do you recommend aerobic exercise for your patients or the audience?
Oh, yeah, definitely. It depends on your goal, Dr. Josh. So if your goal is for longevity, I recommend all. Weightlifting, body weight, cardio, yoga, meditation, HIIT, balance training. I recommend all, and I do all myself.
Nice.
But cardio it's another medicine.
True.
You can't have a good brain without a good heart. How is your heart going to pump blood to your brain if your zone 2 cardio is crappy? How are you going to lift weights long enough if your heart can't pump? So I do recommend all my patients to at least walk at least 30 minutes a day. That's like a bare minimum.
Sure.
That's what we doctors all memorize. Oh, do 150 minutes, a week. But that's the bare minimum.
Right.
That's not the goal. So if you want to lose weight, it's 300 minutes a week.
Right.
But for me, I say be as active as you can. Use the stairs, don't use the escalators. In Thailand, we have motorbikes. You've been to Thailand.
Sure.
You have a lot of, short motorbike rides. I'm like, don't use the motorbikes, just walk. So I do prescribe zone 2 cardio as well as HIIT. But HIIT, I only prescribe once a week, maybe twice a week, to increase your VO2 max. That is also the best, well, not one of the few.
Right. And HIIT training is basically interval training.
Yes.
Where you work out really hard for a short period of time and then recover and then do it again, right?
Yep. So it's, that's it. So there's many protocols like the Tabata from the Japanese guy. There's a 4x4, the Norwegian 4x4, which is very popular. Okay. But that one is very intense. Have you done that? The Norwegian
I have not.
4x4. It's like 4 minutes of 80% heart rate, followed by three minutes of upper zone 1, lower zone 2, and then goes back to 4 minutes of 80% max heart rate. If I encourage you to try that, but please get a good night's sleep before. Okay. Because I get exhausted just from the first cycle.
I'll try the Norwegian. When I heard that, I thought, it's just like a cold plunge or something.
Oh, no. It's, but the cold plunge is good as well. But that is one of the better exercise study to improve, VO2 max.
Sure.
And for anyone who doesn't know what VO2 max is, it's the amount of oxygen, the maximum oxygen your heart, lung, and muscle use in 1 minute. The higher, the better, right?
Sure.
The higher it correlates with longer longevity. So I do recommend cardio as well. But what I do want to recommend, maybe for your audience as well, is to weightlifting as cardio.
Right.
You know, so do higher reps, lower rest periods, but mix with lower reps and, you know, more weight as well. Don't just do, you know, low weight, high reps all the time. You want to do all the rep ranges.
Right.
So I think with Alzheimer's, you know, because you host a very popular Alzheimer's breakthrough podcast, I would recommend everyone to lift weights in all rep ranges. Try to do six reps, but heavier weights.
Okay.
But this is for people who are advanced lifters. You know, don't start lifting 6 rep max. Don't do that. But start with 8 to 15 reps, you know, with maybe 70 to 80% of your 1 rep max.
Okay.
If you're not familiar with the 1 rep max, that's the amount of the 1 rep max, and that's it. Don't do that. That's what we use as a benchmark. You know, but I wouldn't recommend seniors to do 1 rep max. Don't do that, please. Do 60 to 70 at most, 80% 1 rep max. But you know, Dr. Josh, there's a recent research on lifting heavier and increasing blood flow to the brain.
Right.
But it's about 3 to 6 reps with, you know, heavier weights. But then again, before you do this, please have a good trainer. Make sure your form is dialed down.
Right.
Make sure you don't have pre-existing neck, back, joints conditions.
Right.
You know, if you do, get that rehab, get that fixed, and starting your way, going to weightlifting, start with body weight and slowly increasing your weight.
I love it. So you mentioned start with body weight. Is there ever a role for like a weighted vest or a backpack? Do you ever recommend or use something like that?
I have. That's a very good question, Dr. Josh. So weighted vest, I have a 20 kilos, so that's about 44.4 pounds.
Right.
Weighted vest I do for chin-ups. I have tried for walking uphill with a weighted vest, but my problem with weighted vest is it bears a stress on your trapezius.
Right.
After a while, it could induce headache in some people who are sensitive to having stuff weighing down on your you know your neck, your trapezius, and your back. But it's very beneficial if you want to do dips, you know, or do chin-ups, or even just push-ups, weighted push-ups, you know.
Right.
But then again, if you have a gym and you have a proper weighted belt, that's a better alternative. But I have my own pull-up bar at my house. So what I do every morning is I try to do 15 chin-ups or pull-ups, you know, alternate days. And then I would put on the vest and do maybe 6 reps, you know, to failure, just once. You know, I don't train super hard like I used to anymore, but I try to have natural movements every day, which is dead hang, chin-ups, pull-ups. But I do understand that chin-ups and pull-ups are very hard for people who haven't done it at all.
Right.
So do get a gym with an assisted machine.
Right.
Or start with a dead hang. There's a lot of studies on if you can dead hang. I think for us guys, for male, I think about 100 minutes to 100. 100
minutes.
100 seconds. Sorry, 100 seconds. We're not Superman. 100 seconds. So for male, 100 seconds to 120 seconds. That correlates with longevity. And for women, I think about 60 to 100 seconds. So my best was 150 seconds, just dead hang. So start with dead hang first and do assisted chin-ups and assisted pull-ups if you have a proper gym. Now, if you don't, get a weighted vest if you're advanced. Now, I don't recommend elderly new beginners to strap on 20 kilos and dead hang. Don't do that. So it really depends on where you're at, you know, and your existing conditions and your goal. But then again, everyone's goal should be get stronger. You know, it doesn't have to be bigger muscles. You know, it doesn't have to be bigger muscles, but that comes with getting strong as well.
True. And some of my patients and some of the listeners out there, you know, they may want to exercise, but they may have like a bad knee or a bad hip. What would you suggest to someone who has one joint that just isn't working, but they want to start exercising?
That's a very good question. So I have many joint problems. If you can hear my crepitation from here.
A little bit.
I have a lot of joint problems. So for folks who have joint problems, I would recommend, like I said earlier, to do light body weight first.
Okay.
It depends on the joints. So if you can do like a full squat, you can do half squats. You can do wall squats, right? And you can even get a band to work on your glutes more. You don't have to go full range of motion. I think range of motion is very key to people with joint problems, to find your specific range of motion where it doesn't trigger pain. And it's different for everyone, For me, I'm lucky. I rehab myself. I can do full squats. I can do cross-back squats, but you don't have to be that flexible. But you got to start. The key is to start. Don't let your joint problems hinder you into getting into weightlifting. And with knee problems, try walking backwards. Have you tried that, walking backwards?
I haven't, but that sounds amazing.
That really helps with my knee. If you have knee problems, work on your tibialis anterior. That's your brake muscles. Motorcycles and cars have brakes.
Sure.
We humans have brakes as well. It's called the TA. So the best way to work your TAs, there are about 3 exercises I recommend. One is to walk backwards, but do find a treadmill and please go very slow, like maybe 1 mile per hour slow, super slow, just to get on, just to get your brain,
working.
Yeah, and that's a good way to probably lower Alzheimer's too. Doing new things, doing backward things or opposite things. It's a really good way to making newer connections. So walking backwards slowly and increase the incline. What I recommend, I do it for myself and it helps with my knee pain tremendously, is I put the incline on max. So it depends on what machine you have. So mine is like level 15, but go very slow and be very focused on your steps. You want to step on your tiptoe and then stretch it all the way out so that your rectus femoris and your TA are fully worked.
Okay.
Long steps, long strides, and really flex your leg muscles. Do that maybe 5-10 minutes a day. And another exercise is called tibialis raise. So you would stand next to a wall and just do this, the opposite of tiptoe. When you're standing on your tiptoe, you work your gastrocnemius, your calf.
In back. Sure.
Yeah. So you want to stand against the wall and I don't know if you can see it in the camera, but maybe we can edit it in later. You just pick up your front foot and just hold and do that 20 reps. You're going to feel a good burn on your TA for sure.
Would your heel be down?
Your heel would be down. Your heel, it would be like this. It would just be like this. I mean, you can't even...
So you're basically tapping.
Yeah, but you want to go slow.
Slow.
You want to squeeze at the top. When you go at the top, you squeeze for like 1 to 2 seconds and down. And when you go down, you don't want your tiptoe to be all the way rested at the bottom. You want it to go like just about and then go up. So you want to keep the tension throughout the 20. And you want to aim for 20 reps.
Okay.
And don't go super heavy, right? And the last one would require a equipment. So it'll be a sled pull, but a backward pull.
Oh, wow. Okay.
So does that make sense?
Sure.
So usually you push this way, right? So now it would be, you would strap onto your waist and then you would have a strap and then you would walk backwards with a sled. So that's kind of like a weighted walking backwards. So that would be another level. Once you're comfortable with walking backwards uphill, I would really recommend the weighted backward sled pull. That would really be good for your knees, for sure. Yeah.
Awesome.
I'm a patient in that as well. So I know how that feels. Totally.
Awesome. Dr. Oak. Or Dr. Sixpack. But changing gears a little bit here. Obviously Alzheimer's and dementia is a big deal here in the United States, but I looked into it. It's also, unfortunately, a big deal in Thailand and other Western countries. Tell us more. The numbers I looked up, I mean, and you can debate the exact number, but I think we're dealing with maybe 1 million people, 1 million Thais have Alzheimer's right now as we speak. And to me, the scary thing is that number has gone up by a factor of 3 maybe in the last 20 years. So it's going up in the wrong direction. First of all, why do you think Alzheimer's has increased in Thailand, and what can people do about it?
Sure. So I am not a neurologist, so I have to, make that clear. And I am not a statistician.
Right.
Yeah, the numbers, what you said is not wrong. Right. The numbers are pretty scary. Like probably millions that don't know they have early onset Alzheimer's. Now the full-blown disease, the exact numbers, I'm not sure, but probably in the tens, if not hundreds of thousands. And we are going in the wrong direction. Probably number one, pollution. We have a very, very bad pollution problem from people burning leaves, burning trash, and from neighboring countries burning stuff. I don't know why people keep doing that. It's really hard. And even for me, when I go back in a few weeks,
right.
I'm going to be breathing that particulate matter air. And you know, the safe limit is five cubic meters. 5 micrograms per cubic meters.
Okay.
That's the safe level from the WHO. But in Thailand, now this is a very dramatic issue, a very controversial issue. In Thailand, we say it's safe at 50, which is 10 times.
But 10 times worse.
Yeah, but now we're lowering it down to 32.5, which is still 7 times worse.
So it's a little bit better, but still worse than the recommendations.
Yeah, and so I'm very happy right now to be breathing in Florida air, very clean air. So that's our number one problem right now that I try to give, you know, education on my platform, and a lot of doctors are trying to raise awareness on that. But it's very hard, Dr. Josh, because it's not a Thailand problem. It's like a Southeast Asia problem.
Right.
So we would require other countries to dial down on their burning. How do you guys have do you guys have pollution at all here?
Unfortunately, pollution is bad. It depends on the city. It depends how close you are to the ocean. It depends on wind.
That's wind.
You know, I grew up in Los Angeles where really bad pollution. And I remember going to Pasadena for a summer, and literally as soon as I got there, I was in tears. My throat.
You can feel, huh?
You can actually feel it. And I remember, you know, looking at the picture of someone whose lungs, who lived in a polluted environment, and it's just like they've been smoking. You know, it really is smoke and pollution.
It is.
So it's not just your country; it's the United States and it's elsewhere. And frankly, it's not just pollution outside; it's indoor pollution. There's off-gassing from whether it's flooring material or carpets or plastics. It's car seats,
paint, house paints.
Correct. It's a real issue, and you know, I compliment you on understanding that and then educating the public, and you know, not freaking people out, but just say let's make some obvious choices. And you know, going back to our last discussion, sure, I want people exercising outside, but not if the air quality is bad.
Yeah, so that's the number one upcoming problems that's contributing to Alzheimer's. So the next one, Dr. Josh, the number two, but I think it's actually number one that's been around in Thailand for a long time is sugar, to excessive sugar intake. We are sugar addicts. I used to be as well, but now I'm not. And I do see a lot of foods and drinks here are very sugar-ridden as well.
Right.
It's like we copy you guys. Whatever you guys have, we have. But not in a good way. You know? And all the drinks in Thailand, you know, when you go to cafes, they're all laced with high fructose corn syrup.
Oh, wow.
Yeah, that's like our number one drug. That's our number one drug.
Sure.
And I tell my audience to order zero sweet. You know, หวานน้อย or หวาน ศูนย์ means zero sugar.
And that's,
I have to say zero because when you tell them low sweet, it is still like a tablespoon of high fructose corn syrup. And I'm like, it's still not acceptable to be eating high fructose corn syrup at all, right? I mean, now it's been taken out from the grass category just recently, thank goodness.
Right. generally regarded as safe.
Yes, generally regarded as safe.
Right. But it's interesting. In this country, I grew up on something called Thai tea.
Oh,
they would take the tea, and they would add all this sugar. But you're saying you could actually, in Thailand, you could actually ask, please, no sweetener, no sugar, and I guess you have to say, but I mean none.
Zero. If you say low sweet,
Okay.
we have 4 scales, right, Dr. Josh? 1 is 100%. That's normal. Okay. Normal is 3 tablespoons of high fructose corn syrup.
Oh, wow.
Which is a liver toxin, a brain toxin. It's a toxin. Right. When you ingest it, there's uric acid, there's radical oxygen species, triglycerides, fatty liver.
Bad news.
If you eat too much, of course. Now, if you just take 1 teaspoon, the dose makes the poison. But no one takes a teaspoon in Thailand. It's the normal dose is 3 tablespoons.
Oh, wow.
That's 45 grams of just toxin.
Right.
So even when you say low, you have 75, 50, 25, or 0. So I tell all my patients and my audience, 0 sweet. Or I tell them to bring their own natural sweeteners like stevia or monk fruits. But then again, it's you got to be, that's a bit more nuanced, monk fruit and stevia. So I do advise them that, and I tell that to my brother as well. My brother, he loves, sugary drinks. And I tell him, I have some organic monk fruit. Just take them to the cafe with you and just add it in later. It tastes just the same. Or at least lower the, high fructose corn syrup.
Right.
And maybe substitute it for honey. But then again, honey is still sugar.
Of course.
If you have fatty liver, I would not recommend, 3 tablespoons of honey.
Right.
I would still say as little as you can. So I would say that's the number 2. I mean, the number 1, but it's been around for forever. And it's still not going away. And it's a good business. Sugar is a good business. It's a good dopamine hit. And that's why I do what I do. And I'm sure yours as well.
So totally. Let me ask you, and one thing I've noticed being in this field for almost a dozen years now, working with Alzheimer's, is one of the potential 200 causes of Alzheimer's is parasites. Parasites in the brain, and I'm asking you this question because I notice when I have patients who are either from Asia or they've taken trips to Asia, they normally have much more parasites. Now, just to be clear, many of them have parasites, but if they've been to Asia, they often will have higher quantity and different types of parasites. What has your experience been in Thailand with parasites in general and then specifically with the brain?
Oh, sure. The neurocystic cirrhosis, that is, in layman's term, that's the Taenia solium. It's a parasite in raw pork, raw pigs, raw pork. And, and when you eat it, they live inside you and then they become eggs, and the eggs can get dislodged in your bloodstream and go to your brain. And I think you would probably die from, increased intracranial hemorrhage than before Alzheimer's. But back to your question, we have a lot of raw menus, Dr. Josh.
Right.
But I don't eat it. I only eat raw sushi. But then again, those are of higher quality. I don't make my own raw sushi. Obviously, I don't make my own sashimi. But in Thailand, we have a lot of raw beef menu. It's called, what is it called? Like Sửa Lóng Hai, not Sửa Lóng Hai, Chui, and Goi. It's like raw beef and raw clams. And we have a belief that if you squeeze lemons on raw fish, that it would cook the fish and cook the parasite. And that's a northeastern Thailand problem. The parasite is called Opisthocus viverini, OV, and that gets dislodged in your bile ducts, and it gives you bile duct cancer, liver cancer.
And that's a type of parasite.
That's the type of parasite, Opisthocus viverini, or OV. So we do have a lot of parasitic problems in northeastern part of Thailand the most. That's where the prevalence of bile duct cancer and liver cancer is more prevalent. And not just from parasites, but from alcohol as well.
Right.
But but from parasite, it's a big problem. So I do advise people who are trying to go abroad to at least order cooked food, please. If you want to do, raw sushi, it's fine, but take some albendazole, mebendazole, just in case.
Anti-parasitic drugs.
Yes, sorry. So it is anti-parasitic drugs. And if you go to Thailand, they're over-the-counter. You don't need prescription for that. In Thailand, lots of things are over-the-counter. So I do take once a year for myself. Not that I eat raw pork or raw beef. I don't. But I do like my medium rare steak. But then again, that's probably no Taenia saginata. That's a parasite in raw beef as well. So I do recommend people, your audience, to, if you go to Asia, Southeast Asia, Philippines, Thailand, Vietnam, Laos, whatnot, if you're going to eat raw meat, just when you go home, take some anti-parasitic drugs. I think it's like a three-day course, done deal. So specific medications you can ask your doctor, but I would. Now this is not medical advice, right? So, but for me, I would take albendazole and ivermectin, just so it would cover all the parasites. There's tapeworm, roundworm, nematodes, cystodes. There's so many. So you want to take a broad, anti-parasitic medications. But the best is prevention, Dr. Josh. The best is to avoid these exotic raw, dishes.
Awesome.
Yeah.
So it sounds like you're wearing a lot of hats, because not only do you have millions of followers on social media, you also still work in a hospital and in Bangkok.
Yep.
And then you are also in the process of setting up your own clinic.
That's right.
I guess also in Bangkok. Yep. So how do you balance all of this? And do you work with anyone with brain issues?
So I still work at a public hospital once a week, and I do my own private consultation as well. I have my own business, as well on supplements. And I do work one-on-one right now with a lady. She's 65. She has a severe fatty liver. Her liver enzymes are close to 100.
Okay.
She's overweight. So I've worked, and she has a family history of Alzheimer's. Her mom, her aunt does have it. And I took her ApoE test, ApoE, for anyone who's not familiar. It's a gene associated with increased risk of Alzheimer's. I'm sure Dr. Josh probably talks a lot on that already.
Apolipoprotein E.
Yeah, apolipoprotein E, or ApoE, capital E. For short, there's three types, 2, 3, or 4, and there are 2 alleles of each. You want the E2, which is protective gene, and E3 is the normal gene, and E4 is the hazardous, risky genes. So the lady I work with, she has E3, E4, just like me. I have E3, E4 as well. I found that out. And my main goal for her is to, lifestyle, prevention, everything to, mitigate or lower all risk associated with Alzheimer's for her. And it's very, very personal for her as well, because she watches her mom died of Alzheimer's. And I'm sure you have a very personal story with your grandmother, which of course I'll be asking you that in a moment.
Sure.
So I work with her. My number one advice for her is to get stronger, as in like muscle wise, heart wise, and eat whole foods, plant-based, and some animal-based. I don't recommend just one or the other, or I recommend whatever works for you, whatever works for her lifestyle. And also to sleep as well. I also tell her to send her sleep recording every night to me. I try to optimize her sleep, because she would have a problem waking up at 3 a.m. and couldn't go back to sleep. Now she could wake up at 6 and 7, I had to put her on the blue light blocking glasses.
Right.
I told her to go to the sauna. I told her to wake up and go to the sun. I'd get up, in the sun right away, do some grounding. Grounding is when you have barefoot on the earth or sand, and do meditation, because sleep and Alzheimer's, it's probably like the number one, right? Sleep and Alzheimer's,
sure.
Right? So I try to get her sleep fixed and, lift weights. And it's been 2 months, Dr. Josh, and she started with 89 kgs. Now she's down to about 80. So she lost close to 20 pounds, and that's pure fat. So I told her to get her in-body. In-body, it's like a body measurement.
Oh, way to measure body composition. Yeah. You mentioned DEXA scan at the beginning. Those are different ways to measure how much visceral fat or muscle you have.
Sure. So yeah, it's pretty much a body composition machine. Not as accurate as DEXA, obviously, but it's more accessible for normal people. So I told her to get her body composition done every week, and it shows a graph. So her body weight goes down, but her muscle goes up by almost a kilogram. So that is a very good sign. So I told her, you are doing so well. And by the way, she has diabetes type 2. Her A1C, which is 3 months history of your blood sugar, her A1C started at 6.8. Now it's down to 5.7 in 2 months.
That's amazing.
In 2 months. Can you believe it? And she lost almost 10 kgs. And I'm like, and she's like, I want to lose weight faster. I'm like, no rush. And I want to recommend everyone to don't rush in losing weight. Because if you rush, you're going to lose muscle weight. And that is number one organ to combat Alzheimer's.
Right.
Your muscle is the glucose furnace.
Right.
And I told her, okay, focus on gaining muscle, focus on lifting heavier, but slowly. Don't jump the weight slowly. And she's doing just that. And she just got her lab done New Year's. Very good New Year gift for her because, her A1C from 6.8 to now 5.6, 5.7. And all her liver enzyme is 20s, in the low 20s now, from 80s and 90s. Her AST was like almost 90. Her ALT is closer to 100. Now it's all normal. And
that's great. So basically the liver regenerated. So the liver fixed itself.
Yeah, the liver, I'm not sure if it's the only organ that could regenerate, but it can regenerate for sure.
Well, I mean, obviously our goal to reverse Alzheimer's is we want to get the brain to regenerate.
Yeah. So that's why I told her to focus on muscle. Muscle is key, and muscle sleep, nature, body weight movements, and whole foods, real foods, mainly plants and some real animal product as well. I don't mind her eating eggs, but no fried eggs, right? Just hard boiled, sunny side up eggs, but very limited on saturated fats because there's strong evidence on saturated fats and apolipoprotein B and Alzheimer's risk increase. So I do tell her to avoid animal fats as much as she can, but once in a while, if she wants to eat like grass-fed steak, it's totally fine. If that's your happiness, right? So my concern for everyone, not just her, is don't go too strict that you suffer, because then it's not going to be long term.
Right.
So the key for me and my personal practice is, how do I get someone to do what they do for the rest of their life with joy? Right. The key is with joy, not with stress, right? Because if you do it with stress, then Alzheimer's going to go up. Your sleep's going to go down. Muscle's going to be harder to build. Cortisol is going to go up. Insulin resistance is going to go up. So yeah. And to add in the last part is supplements, right? So I'm not into only supplements. I'm into everything, right? Okay. And I'm not anti-supplements, but I'm not all for supplements only. I do everything. But your diet, exercise, sleep, stress reduction, toxin avoidance has to come first. Then I add in supplements. Her vitamin D needs to be checked. She needs to be taking her omega-3s. I told her to take creatine, HMB for sarcopenia as well, TMG, trimethylglycine, the B complex as well with the omega-3, strong evidence on brain for sure. Lots of fiber. I told her to aim for at least 30 grams of fiber a day, if not more. But then again, fiber is, it depends on if you have stomach issue, you can, go slow on the fiber. There are many more supplements she takes, but I don't want your audience to just do supplements. But then again, I don't want your audience to be afraid of supplements, but you got to choose the right one. Listen to Dr. Josh. I mean, he probably talks already on it already. So that's my history on the patient.
That's awesome. And the fact that she had type 2 diabetes, and you also reversed, or in the process of reversing.
Almost there.
Almost there. And as you know, type 2 diabetes, if it involves the brain, can be called type 3 diabetes.
Yeah.
Again, she was doing it for prevention, but if she hadn't met you, she may have been going down that route. And what I love is that story where she had ApoE3/4, so it had increased risk of Alzheimer's from the ApoE4, but because of these lifestyle changes, her risk has now gone way down.
Yeah.
Which is amazing, which it's about agency and taking control and including joy. So one of the things I wanted to ask you, Dr. Oak, is, we actually were both board certified by the American Board of Lifestyle Medicine. And, how in the world did you find lifestyle medicine?
Sure.
Yeah.
Sure. So that's a very good question. So just to clarify, our certification is, they have different names.
Sure.
Yours is an American Board of Lifestyle Medicine.
That's
so
true.
Mine is an International Board of Lifestyle Medicine, since I'm not American.
But it's linked. The curriculum,
the same.
The beliefs are
Right.
very similar, regardless of what country you're from.
Sure. So 6 pillars, right? So how I found that out, I guess I've been practicing that my whole life without knowing it's actually lifestyle medicine. But then I looked up, like, is there a prevention branch of medicine? Because we were not taught nutrition that much, if at all, right?
Right.
But since I was into bodybuilding, so I studied nutrition a lot. But then I think, how did I find out about it? I took a course from Harvard on metabolic syndrome by the lifestyle medicine, but from Harvard. It's an online certification. So I took that like 6 years ago. Yeah, 6 years ago. And I was very intrigued that there is a lifestyle medicine. And Dean Ornish, I think, is the father of lifestyle medicine. So I think that's how I found out, because I try to, I'm a learner guy. I'm still learning every day. I'm learning from you. I learned a lot from your lecture in Novato.
Thank you.
So I looked up online. Is there a prevention, medicine course that I can take while I'm in Thailand? Because back then, I think it was 2020, COVID just hit.
Sure.
Right? COVID just hit all around the world, and the hospital were closing down. The outpatient that I go to got closed down. Only emergencies only. So I looked up online and I found out, there is a American lifestyle medicine course in Harvard, but it's an online thing, So I took that. It's on metabolic syndrome, a very good beginner's course for sure. And then only recently that Thailand got involved in the lifestyle medicine, only 2 years, I think. So I'm like the pioneer I'm not the pioneer, but I'm the second year.
You're at the cutting edge.
Thank you.
In Thailand. That's
Thank
great.
you. But there are many doctors do what I do as well. But that's how I found out. And I'm in love with it. I'm in love with it. The 6 pillars. But I want to add in other pillars as well that, lifestyle medicine doesn't do, supplements and, advanced testing, what you do as well. So,
Sure.
So yeah, it's amazing.
Beautiful. Wow. So I'm also curious because you got started in bodybuilding.
Amateur. Sure.
Amateur.
Sure.
But if you look at the professional bodybuilders, most of them are not in good shape. They tend to not survive long. I mean, you hear about bodybuilders in their 40s,
even 30s,
40s. Their life expectancy is not long. So help my audience understand, because we just talked about how you really want lots of muscle, but here are these bodybuilders that probably have more muscle than anyone else.
Sure.
But their life expectancy, their longevity isn't there.
Sure.
So where's the disconnect?
Sure. So that's a very good question, Dr. Josh. And I have to clarify normal muscle growth or muscle gain to enhanced muscle gain. Now, by all means, I don't mean to bash or I don't mean to look down on anyone. And more respect to bodybuilders, professional ones. You have no idea the amount of discipline, the amount of food weighing they have to go through. I mean, I did that myself as well. But I think the disconnect is the exogenous therapies that, they put themselves through. And I think it's not my opinion, but in science, it's tough for the body to maintain such amount, supra physiologic muscle gain, right? That's, over the normal, right? In layman's term, right? Supra physiologic. So over the normal amount of muscle, I think that's when your heart start having problems. That's when you have, heart hypertrophy, your heart muscles dilate, you have, plaques, increased plaques deposits from the. I'm not an expert on the hormones, but from the exogenous hormones that they use that causes plaque depositions and heart failure and cardiac myopathy and whatnot. Because that's what kills them is heart attack, right?
Makes sense,
right? And if not, then they have a pre-existing valvular heart. There was this young guy called I think his name is ZYXX. I don't know if you've heard of him. He was very popular. Very aesthetic looking guy, very young.
I don't know him.
And he died in Thailand.
Seriously?
Yeah, he died in Pattaya, in a sauna, which is sad. He's like 29 or 28. But his body is super fine, like a Greek god aesthetics. But it turned out he had a valvular heart, issue. It's a congenital issue. But I don't know the connection with the hormones or whatnot. But if you are going to do that, which I don't mean to stop you, please consult your doctors. If you're going to use TRT, if you're going to use peptides, if you're going to use HGH or whatnot, please have a physician who has knowledge or a physician who is doing that to himself as well. I think the best is you need an expert who is a practitioner in that field as well. Just like me, I do rehab for myself. And, so a doctor as a patient is probably the best doctor, because you're also a patient. So I would recommend if you want to go that route to really think your goal, like what is your goal? Why do you want that much muscle? I would recommend just physiologic, normal muscle. Right. Just dial down your protein, 1.6 gram times your kilograms in body weight, or maybe in pounds, maybe 2 to 2.2 now. I think that's what research has shown to maximize muscle gain. So yeah, the disconnect is the supra-physiologic level, Dr. Josh, and the amounts of work your heart has to pump to keep up, with all that muscle.
Right. And where the bodybuilders may feel competition, like in order to win, I need to have more muscle than anyone else. And let's throw safety aside. The way to do that is just to take, like you said, supraphysiologic or huge doses of testosterone or growth hormone or whatever it is. And it unfortunately is short-sighted because, great, you may win that next contest, but if you die in the sauna next week, I mean, what's the purpose?
Yeah, but the sauna probably has nothing to do with the death, but the sauna is very good, even for Alzheimer's as well. We love sauna. Yeah, we love sauna. We don't mean to throw you away. It just happened in the sauna. It doesn't mean the sauna killed him. I think another thing, Dr. Josh, is when they go on stage, they have to water depletion, sodium restriction, and extreme carb loading. Because I've done that too.
Right, in order to see the fine muscle fibers from an aesthetic standpoint.
Yes, and I've done that too. And it's very, very tough on the body. And it's their weakest day of their lives is when they're on stage, super dehydrated, lean to the bone, a walking anatomy board. That's not good for your heart.
No, I've seen a professional bodybuilder, and after the competition, literally, he was drinking like gallons and gallons of water because he was so dehydrated.
Yeah. And the day of the show, it's like barely any water intake, just so your muscle is super dry. I mean, your skin is super dry, your muscle shows up. So yeah, I think it's the combination of the hormones and the stress and the dehydration perhaps as well. Yeah, but it's unfortunate. But hey, if it's your passion, I mean, I'm still into it, but naturally, I think it's the way to go.
Right, and they're natural competitions too.
Oh yeah,
of
course.
So going back to Thailand and diet, you shared with us that at least the current diet is often too much sugar, too much
refined carbs,
and processed foods. What about historically? If you go back to Thailand hundreds of years ago, I'm assuming the diet was a lot more health promoting.
Yeah.
And is there a movement to try to get people to eat like, Thai ancestors ate?
Oh yeah. So that's a very good question. So our ancestral Thai foods are actually very good, like brown rice, minimally sugar added stuff, probably zero added sugar stuff, minimally fried foods as well. It's mainly stir fried. So the thing with stir fried, it depends on the cook. If you put minimal oil, it's very good. If you use, avocado or olive oil, it's very good. But in Thailand, we use a lot of palm oil, which is very controversial. But with regarding to Alzheimer's, obviously you want to lower the saturated fats, you want to lower the coconut and the palm oil.
But even though it tastes good.
all fried foods and greasy food all taste good because it stimulates your taste. But so our ancestral Thai food is very vegetable based, very plant based. Lots of fish, lots of seafood, it's called spicy soup, gang and tom yum. If you know, like tom yum gung, there's the spicy shrimp soup. And lots of herbs. We have lots of herbs. We have lots of local Thai vegetables. That's very good. We have our own Thai traditional medicine as well. Also my other field of interest. I'm the same doctor as you are. I'm not Thai traditional, but we have our own Thai traditional medicine with using Thai herbs, Thai plants to treat cold, to treat other, illnesses as well.
Will you do that with some of your patients?
If they're into it.
Okay.
But then again, I have to look at the evidence as well because it's very different branches. It's like, it's not even Chinese medicine. It's Thai medicine. And when it's completely different than traditional, you and I medicine.
Right.
So, but
allopathic or whatever we call it.
Yeah. No, but I'm Dr. Josh, but I'm all down with everything that has evidence that it works for the patient and the patient is happy to use. I'm all down. I don't, restrict other branches of medicine at all. So our Thai food, I think Thai food, if you eat proper Thai food, not westernized Thai food, not sugar sweetened Thai food, not greasy Thai food, it's actually one of the, longevity diet, I think. Yeah, for sure.
Wow. Yeah. So Dr. Oak, we covered so many different topics on how to prevent and reverse aging and Alzheimer's. Is there a question I didn't ask you that I should have?
Wow, that's a very good ending question, Dr. Josh. I guess would be, what would I recommend for anyone who wants to start lowering the risk of Alzheimer's prevention, since, you have an Alzheimer's podcast? So I think getting your vitamin D checked, your homocysteine levels checked, supplementing with methylated vitamin Bs if you have the MTHFR gene defect. If not, you can take the regular cyanocobalamin. Go to the doctors regularly. I think we didn't talk about that, but go see him regularly, right? or have consult with him regularly, or your, provider regularly. And don't be afraid to get second, third, or fourth opinion. And I'm sure you provided second, third, or fourth opinion to patients as well.
Many times.
Yeah, and definitely don't think that you don't have symptoms, that you are good to go. You know what I mean? Like, don't think that, I'm strong, I don't need to go get my blood work done. Nothing's going to happen to me. And couldn't be further from the truth, because obviously Alzheimer's, there are symptoms, early onset symptoms, but I'm more afraid of heart attack and stroke in terms of like acute death. And there aren't really any early onset symptoms besides shortness of breath. And then you can get a heart attack and die or a stroke. So really go see your doctors at least once a year. That's like the worst case.
Sure.
But for me, I would recommend once every 6 months.
Right. Prevention. Focus on prevention.
Yep. On prevention. And please try to see what works for you. There are, you can cite all the meta-analyses all you want, but what if it doesn't work for you?
Right.
So experiment with a provider who does it himself, like Dr. Josh here. That's it. Go see your doctors and make sure you try different things and see what works for you. If it doesn't, shift. Don't be super focused on one thing. Don't go all in on carnivore. Don't go all in on keto. Don't go all in on veganism. Try different ones, or mix and match.
Right.
There isn't a one size fits all, especially in longevity.
Right.
So that's my ending message. Oh, and also muscle is key. Go lift and enjoy lifting and make that your number one side hustle.
I love it.
So yeah, my goal is to just get girls to lift pretty much and get my mom. Oh, actually I might get my mom to lift.
Okay.
And now she does.
Seriously?
Yeah, but not from me telling her, but from her seeing my patients and my audience get better. Right. I do a lot of live, Dr. Josh. So my mom would come in and watch, and she would see my audience be like, oh, I do what you said for 3 months, and now my diabetes is gone, and I'm stronger. And she's like, oh, now I want that. I think that's key to our parents.
Wow.
I don't know if it's the same for yours, but
yeah,
my parents first.
My parents are the same. I can make suggestions, but they actually have to see it in other people before they'll change. For many things, I think it's a family thing. So
it's a universal thing.
Yeah,
for sure.
Yeah. So tell me, where can people find you, Dr. Oak? First of all, in social media.
Sure. You can find me on all platforms, in TikTok, Facebook, YouTube, Instagram, and in Thailand we use an app called Line. That's our WhatsApp. The name is Dr. Oak Suffolk, or you can type in Dr. Sixpack. That's my pseudonym, my nickname, online name. But my content is mainly in Thai though.
Okay.
But in Facebook, I do a lot of text posts as well, like every day. That I think Facebook automatically translates to English as well. I have many American friends and families. They do press the translate button, and then you could read it all in English as well.
I've heard many of your videos with English subtitles. So, or in English. So, there's definitely, if you don't have to be in Thailand to listen to you. So,
yeah, for sure.
Awesome. And then if someone wants to reach out to you, potentially to get specific advice.
Sure.
Do you do teleconsulting or anything like that?
Sure. Thank you. Yeah, I do teleconsultations, telemedicine. You could email droakwellness@gmail.com, or you could send us a DM in Facebook, Instagram, or TikTok. I have my team who will take in, inquiries if you're interested. Yeah, for sure.
Wow.
Thank you.
Dr. Oak, thank you so much for being willing not only to come to America, but to share your wisdom with my audience about Alzheimer's, about longevity, and I love that the movement of lifestyle medicine is spreading. It's not just the United States; it's Thailand, it's throughout the world, and that you love prevention.
Love it.
And it may not be popular yet, but that I think is where everything is going. So I really appreciate your willingness to focus on these really important topics. So, what I took away from today is the importance of building muscle to help your brain health. And I certainly don't have a six-pack yet, but I would say, based on your advice and inspiration, I'm going to get there. So, thank you so much for watching this episode. And if you like it, obviously, click like, subscribe, but share this episode. If you found this helpful, share this episode with a friend or a loved one who may benefit from this content too. So Dr. Oak, I salute you and thank you so much.
Oh, the pleasure's all mine, Dr. Josh. And it's a great honor to be interviewed by you. I consider you probably one of my mentor in the aging field as well. And it has been an honor to be able to share my insights and my experience with your audiences as well. And my last message would be, please visit Thailand. It's a lovely country, and you have been there as well. Please come visit us. We have a beautiful country, good food, and yeah, please do come visit Thailand.
Excellent. I'll visit, and then hopefully we'll do another interview there in person, but in your country.
For sure. I'm taking your word for that,
Awesome.
Josh.
Yes, we'll make it happen. Peace and plants.